Hello, everybody. My name is Austin Brown. I am a pharmacist and vice president of the Advanced Care Provider Network here in Jackson, Michigan. So you'll find me over at Brown's Advanced Care Pharmacy on Robinson Road, and sometimes over at Brown's Advanced Care Medical Supplies over on West Michigan Avenue. We wanted to say thank you for to the chamber for letting us have this opportunity and speak with the community. Got some questions for you guys that people submitted, and we're going to take a look at those and see what we can do for you. So our first question is, how can I change my prescription from a 30-day supply to a 90-day supply? And that's a great question. It's something that we have people asking us a lot. In order to do that right now, depending on how the prescription is written, if it's something for the pharmacy, your doctor can write that new prescription for you. So you can reach out to the doctor to get that new prescription. It's something the pharmacy would also be able to help you with as well. If you call the pharmacy and ask about that, we might be able to help mediate that conversation between you and the doctor's office. But that is something that can definitely be done. Sometimes people request 30-day supplies on their prescription, even though the prescription itself was written for a 90-day supply. If you have refills remaining on that prescription, and that prescription was initially written that way, we can fill off of that prescription just like that as well. So that would be a pretty easy fix. So first thing you can do, honestly, is call the pharmacy, and we can help you figure out what conversations you need to have with either your doctor's office, or if we can do something for you, we can do that for you as well. So our next question here is, I can't reach my doctor's office for refills or changes to my prescription. What else can I do? That's a great question, because there's some of the doctor's offices right now, they might be closed, or their hours have changed, or their staffing models have switched around with a lot of this. So that's not the first time we've heard that question. So one of the things that pharmacy has been able to do during the COVID crisis is act through an executive order that was signed through by the governor. And if you have had trouble contacting your doctor's office and you've tried multiple times, and even if your pharmacy has tried multiple times, if you have that interaction with the pharmacist and your pharmacy team, our executive order allows us to actually refill an existing prescription for you, especially in times of being able to, or having a harder time getting a hold of everybody. So that's something that we can do at the pharmacy. Now, one of the caveats about that is it has to be for an existing therapy. It can't be for a brand new prescription. So the pharmacy is not allowed to do that for you. But for example, if it's a high blood pressure medication that you're taking and you're having a hard time getting a hold of the doctor's office, you're having a hard time, the pharmacy maybe is having a hard time getting a hold of the doctor's office, the pharmacy can fill that prescription for you so that you can continue making sure that your blood pressure is under control. Next question we have here is, my prescription needs a prior authorization, but my doctor's office is busy. Do you have any other suggestions? That's a great question. And that ties right into a little bit about the previous question about I'm having a hard time getting a hold of them for a refill. What can I do with that? So when insurances require a prior authorization, the first thing that generally tells me as a pharmacist is it might be on the insurance when they have their formularies or their drug list of how they like to cover their medications under your insurance. If a drug requires a prior authorization, a lot of times that tells us that it's a medicine that they want to see more evidence from the doctor about why they want you to use that particular medication. And there might be another medication that might be less expensive that the insurance company would like you to try first before they fill that one. Sometimes that's the case. And if that is the case, and this is a new prescription for you, and then we find out it's a prior authorization, there might be another medication that we could recommend for you at the pharmacy and have that conversation with your doctor. And if we can agree on getting that therapy going for you, and we know that your insurance company will cover that one without the prior authorization, depending on what we're treating, that might be the option for you at that given point in time, so that we don't have any big gap in therapy and starting a new medication for you. Now, if it is for an existing medication that requires prior authorization, a lot of times what we can sometimes do is, if you've had that before, the insurance company has that on their records. And a lot of times what we can do at the pharmacy is either recommend that you can call your insurance company or if you have questions, or we can also take a look at that for you and reach out to the insurance company and see if there's an existing approval on that medication. And then we can use that as a starting point to get that prior authorization to go through quicker. So those are a couple options that we have for you if your medicine requires a prior authorization and the doctor's office can't be reached. I have never used a mail order pharmacy. Is now the time to try it? That's an excellent question about mail order. We get a fair amount of people that have come through the doors that have used mail order at some point in time and had mixed results and varying results. So if you're thinking about, because I'm in the house a lot or we're being required to be in the house more often, is a mail order pharmacy a good idea? Quite honestly, if you're able to utilize the resources that you have in your community, that would be the first avenue I would explore. And that being said is, if it's a concern of, well, I can't get to the pharmacy to pick up my medications, one of the things that a lot of pharmacies, especially independently owned pharmacies, have done for years is free prescription delivery. And we also focus on a program called medication synchronization. And when you think about mail order pharmacy, well, what's some of the things that you consider a perk from that? Well, my prescriptions are brought right to my door, and all the prescriptions that I need are brought to me at the same time. A lot of people don't know that your community pharmacies right here in town are able to do that for you. So one of the things that we encourage is using that medication synchronization service. And what that is if you have multiple prescriptions, what we like to do is, instead of you having, let's say you have 5 prescriptions, if you have 5 different refill dates in the month, that's a lot of trips to the pharmacy. But the pharmacy team can actually work with you to line all those medications to be picked up on the same day. And especially nowadays when it's more important for us to stay in your homes, those prescriptions can be delivered right to your door and keep you safe in the house. So there's a lot of community pharmacies in our local areas that actually provide these services. And the other thing that's nice is you can still talk to that person. The people that you speak to on the phone are going to be somebody that you know. They know your story. They know your family. There's not a 30-minute talking to computers, pushing buttons, waiting to talk to a person on the other end of the phone. Especially in times like these, you want to have that community connection, and pharmacies are very well suited to help you solve some of those problems. Next question we have: what if my medication that I need is out of stock? One of the things that we look at a lot in the pharmacy world is supply chain management. And with everything we've got going on right now, supply chain management has become a very hot topic. And one of the big things, obviously, is, well, things are harder to get. Things are running out of stock. What happens if that happens with my medicine? And it's a very good question. And a lot of times it will require a couple different approaches. So it's always a great idea to check in on getting refills for your prescriptions before you run out of medication. I always like to tell people, have at least 5 to 7 days of your medicine left when it's time for you to call in a refill. And that way, if we do run into any complications, in this example, if that medication is all of a sudden unavailable, you're not missing days in your therapy because we waited until the last pill and now we've taken it and now we're out of medicine. So I always encourage people to try to call your refills in ahead of time. And depending on what the medication is that's out of stock, there may be other ones that are in the same class of drugs that we could use in that instance as well. So for example, let's say that you're on a cholesterol medication and that medication is out of stock. A lot of the medications that we use for the cholesterol that's popular, for example, I'll say statin medicines. there's a lot of different types of statin medication. So if we had one that was working well for you and then all of a sudden becomes unavailable, there might be other statins in that drug class that'll still help keep your cholesterol under control. Then they're readily available, and we can switch you over to that therapy, and the pharmacy will work with you and counsel you on how to use that medication safely. So that's something that we keep a really close eye on, is what medications are potentially going to be unavailable, how many patients that we're taking care of are on that medication, and what are the other treatment therapies that we have available that we can use just in case that medication runs out. Our last but certainly not least, what is it like to work in a pharmacy during this pandemic? The COVID-19 crisis has changed a lot of things for a lot of different people. Pharmacy is no different. I think one of the biggest changes was it really makes you take a close look at what you have available for your teams when something like this happens. So I think a lot of us are looking forward to the future, and I don't quite frankly think we're ever going to go back to the way it was. And what do we need to do to make sure that we're prepared in the future? So it made us take a really good hard look at that. A heightened sense of safety in the pharmacy in terms of infection control. A lot of things that I think will continue to, a lot of practices that I think will continue to move forward even after this. Just practicing the good hygiene and increasing that, hand washing, sanitizing our stations, things that any healthcare organization does and has policy for, but I think now it's going to be ramped up even more so. The in and out traffic of the pharmacies has been slower. So, for example, the pharmacy over on Robinson Road is only working through the drive-through at this time. So we don't have as much as that in and out traffic. And it separates us from the community a little bit, but at this time it's really important to keep everybody safe. So we're thankful for the drive-through so we can keep taking care of people. We're excited that we're able to deliver medications to people's homes. So it really feels a little bit more like a closed door operation. But at the end of the day, I think the biggest thing I've found what it's like to work in the pharmacy is the people that work there. I mean, this is something where we've all been asked to step out of our comfort zones and do something that we never thought we'd have to do as a group. And we've had people coming out of the woodwork that have just been amazing community leaders, not just here in Jackson, but across the United States and the pharmacy profession as a whole. So I think pharmacy as a profession will be looked at in a much different light across the United States after we all come out of this on the other side. And I think there will be a lot of people that ask questions about what else can pharmacy do as a member of the healthcare team to help take care of people, not just in times like this, but what we do moving forward, and how can pharmacy be in the game and get off the bench and really be a healthcare provider in the community. I wanted to say thank you guys so much for tuning in. Really appreciate your time. Again, thank you to the Chamber for giving us the opportunity to do this. We're proud to be a part of this community. We're proud to serve the city of Jackson and the surrounding areas. Stay safe, stay healthy, and we'll see you all this when it's over. Come on over to the pharmacy and say hi.